Hi everyone, it's Dr. MAISAM, naturopathic doctor, and that I have been seeing a lot more of in practice ever since COVID hit, and that is anxiety. So oftentimes what I see in practice is people complaining of insomnia is a really big one, but also chest tightness or difficulty breathing or muscle tightness. A lot of the time people carry a lot of their stress in their shoulders. In addition to that, sweaty palms, feeling very tired or fatigued. And another big common one is heart palpitations, which is why it is very, very important for us to make sure that there are no underlying other conditions with the heart or anything else that's going on in the body. So seeing a licensed healthcare practitioner is really, really important because we can do the necessary blood testing and we can make sure we are being safe and we are treating anxiety if it is just the anxiety, and we are treating something else if there is something else that's going on as well. One of the biggest questions that I get in practice is if diet plays any role in our mood. And the answer to that is yes. There is a lot of research that is now emerging and showing the big link between having an increased diet with refined sugars and how that is actually affecting mood disorders. So one of the things that we get rid of or try to eliminate from our diet for patients who have a lot or experience more anxiety is refined sugars. Another common trigger is, you guys are not going to really like this probably, but caffeine can also be causing a lot of anxiety for people without them knowing it. So we try to get rid of that as well in the diet. Of course, there is important blood work that we sometimes need to run to check on things like your iron, like your vitamin D, your vitamin B12. Vitamin B12, for example, is a vitamin that can be associated with helping improve mood. So we want to make sure those things are in. So making sure that we are getting enough folate in the diet, magnesium, B vitamins, L-Tryptophan is another really important component to anxiety because it is a precursor to serotonin, and serotonin is that neurotransmitter that is really, really important for mood. Making sure that we are getting enough iron in our diet. One of my favorite go-to supplements for anxiety is something called L-theanine, which is actually an extract from green tea. And there is also a lot of herbal supplementation that we can use as naturopathic doctors. Things like chamomile, lavender, kava kava, passion flower, all of these herbs are really very strong for helping with anxiety symptoms. The biggest note that I would say about anything that is natural is that you really, really want to do it under the supervision of someone who is licensed, because even though something is natural, it doesn't mean that it doesn't have side effects, and it doesn't mean that it won't interact with any of your medications, and it also doesn't mean that necessarily it is good for you. So you really want to be doing it under the supervision of someone who has expertise and can help guide you to what your body and what your anxiety really needs in that case.